Hi, my name is Danielle MacNeil. I'm one of the head and neck surgical oncologists and reconstructive surgeons at Western University in the Department of Otolaryngology. And I'm also the rotation coordinator for the head and neck rotation. So our otolaryngology training program at Western University is the best in the country, we believe. In particular, the head and neck rotation is very well-rounded. We have 4 head and neck microvascular surgeons here and 1 endocrine surgeon who is a former reconstructive surgeon and actually the dean of the university. We have a strong head and neck rotation. Our residents get a great training in endocrine and all forms of head and neck cancer surgery, including the facial nerve reanimation. We have a great basic science research program as well, and also lots of research opportunities for our head and neck residents. What we look for in a candidate for our otolaryngology program is somebody who will be part of our family, who will work well with us, both our residents, but also us as faculty. We are hardworking and really respectful of our colleagues, and we're all very motivated to be good and excel at our job and our profession, and we expect the same of our residents as well. Our philosophy in our residency training program is to train the best residents that we can so that they'll be really exceptional otolaryngologists and that they're well enough trained that when they finish our residency training program that they can go out into the community and feel comfortable to do whatever surgery and see whatever kind of patients or however they want their practice to be focused, and also to get really any fellowship that they desire. In terms of how we get along as a group, we really consider ourselves to be a big family. We all, in terms of our faculty group, we all treat each other like we're family. In terms of our residents, they get along really quite well, and I would say that they're like a family and we treat them like their family members here. And we feel the same way when residents leave our program as well. We have a Residence Day once per year where we ask all of our residents and alumni to come back, and we probably more than any other country in Canada or any other program in Canada, we have the most residents come back year after year to see us and have dinner and celebrate our current graduating residents and the research that our residents are doing each year. In terms of what the work culture is like in our department, I would say we're all very hardworking and we expect the same of each other. We all have a really great balance. In terms of work-life balance, we expect that family comes first, always first and foremost. We expect our residents and also our faculty members to have interests outside of work, and we also encourage it. So while we work hard when we're at work, we also play hard and we have other commitments, and we respect those other commitments outside of work. All of our faculty and in training our residents, we're extremely supportive. When a resident is doing well, we all know about it and we all talk about it, and we all do everything we can to encourage them to do better and really excel. When they're struggling, we all get together and talk about how we can improve how that resident's doing. We're a very open group. Residents feel very comfortable to come to us if they're having a problem or if they feel like they're struggling in one area, or they just really need career advice or even fellowship advice, that we're very open to discussion and to support. We have a very strong research component. We have 3 now surgeon scientists. We just recently hired a 3rd surgeon scientist that have big basic science research labs. And while we're a small department, we're probably we are the most academically productive department per faculty member. So we all partake quite extensively in research, and not just with our own research, but we collaborate extensively throughout the university and with other science departments and with Lawson. So there's ample opportunity for residents to get involved in a wide plethora of research. That could be basic science research, qualitative research, systematic reviews, educational research, and lots of different clinical research if they're interested. I would say our residents have a great track record of getting the fellowships that they deserve. A lot of our faculty have strong relationships, not just with fellowship directors in Canada, but also fellowship directors in the US and also around the world. So I can't think of a resident that was disappointed with their fellowship opportunity or with their fellowship match. Since I've been here in 2013, and even prior to me, residents have really gotten their first, if not their first, at least their second choice in fellowship training. So I moved here, I originally grew up in Nova Scotia. I moved out west to Vancouver and did my residency there, and then I spent a year in Edmonton. And then I moved here not because I really had any connection with London, and honestly I was a little bit worried about whether I would actually like living in London, being somebody from, you know, who really likes the coast, the East Coast and the West Coast, but I've just had a wonderful time here. I love it and I wouldn't change anything. I think there are a lot of really special things about living in London, and one of the most important things that I was really surprised about is that our patients are very appreciative, very kind, and really just a great patient group to treat, and I think that makes my job an absolute pleasure every day. The community here is very supportive. If you have a family, you know, a spouse or children, there are lots of opportunities, and it's very easy to get children into really great programs. And then there are lots of things to do outside of London. Toronto is a few hours away, the US is a few hours away, and there are two great lakes that are less than an hour away in either direction that have, you know, great little beach communities and lots of things to do. So the sports that I do a lot of mountain biking, running, paddleboarding. I started kite surfing. We have a great little ski resort for learning if you're interested in learning or have children that want to learn. Just 20 minutes, it's actually within the city, and then Blue Mountain is 3 hours away. And then, like I mentioned, we're close to the lakes, so it's really easy to do water sports on the lakes, and a lot of really great mountain bike trails around too. The school system in London is really quite good. I've been very impressed. One of the benefits is that aside from other bigger cities like Toronto and Vancouver, you know, the public school system here is really great. There are also, there's a great French immersion program here. There's a great Catholic school system here. And there's even lots of really great opportunities within the public school system. My daughter just got into the Pearson School for the Arts, which is a public school system but gives better training and or more training in the arts for kids. And one of my other colleagues, his kids go there as well. So London is very affordable in terms of you know, being able to buy a condo or being able to buy a home. Many of our residents in the past have been able to buy a home and then keep it if they stay, or sell it quite easily. London has really been booming as people are moving outside of Toronto, so the prices are still quite reasonable, and they're not too. You can, you know, get a reasonably priced home within a resident's salary, close to the hospital, not, you know, 30 or 40 minutes away, and then also sell it quite easily when you finish residency. In terms of what we do to support fourth-year medical students in the transition to residency, so it's one of the more challenging transitions in life. You go from having, you know, very little responsibility to quite a lot of responsibility. I think we're really one of the better programs in appreciating that. We have a buddy system that the residents have. They buddy up with their call, so they have a, you know, ongoing mentor throughout residency that really helps them with call. We really provide a gradual introduction for the first-year residents when they're on service. We really value the education that our first-year residents get, so we've thought very carefully about the kinds of rotations that are really important for our residents and the value of the rotation that they do. So, you know, it's not just service-based, but something that's going to be valuable to them going forward. And then we usually, except in the era of COVID, have a welcome barbecue for the residents where they can meet the other residents and all of the staff. Our resident team and also as faculty, we're very welcoming of first-year residents and appreciative of how difficult that transition is. Western University as well has a number of supports for residents that are starting, not just in first year, but throughout the whole residency program. So if they are struggling or having issues with that transition, there are many supports that are available to them. Our surgeon scientists and even other members of our department have been very successful at attaining grant research funding. We know that that's very difficult, and at the resident level that it can be very challenging to get grants. We have a lot of grant supports within the department, and I don't think we've ever had a resident that has had an idea to do a project and then couldn't do it because they didn't have the research funding. The other thing that we do is we have a really great relationship with both the St. Joe's and also the London Health Sciences Foundation. Both foundations engage our patients to give back both financially, but also in terms of how they can help our research programs with their time and with their stories. We've had lots of research projects that have been able to move forward because our patients or other donors in the community have been fortunate enough to give money toward our research programs. I'm extremely happy that I landed in London. I had an idea, I had other offers and there were other possibilities of places I could go, but one of the things that was really important to me was having that sense of family with the people I work with, because I spend so much time with them. And also having that support system as a junior faculty and as when you're just starting out, and also as a junior resident, you really want to feel like the people that you're working with they have your back and they're with you and they'll help you out if you need it. That's important as a resident, but also as a faculty member. And I had that feeling as soon as I came here to visit and to interview for the job here. And that feeling has just gotten stronger and stronger since I've been here. So I'm extremely happy. I wouldn't change my decision for anything.